Welcome back to the Kendra RN. In this video today, we are going to talk about the importance of establishing a baseline with your patients at the beginning of your shift. Now, as a nursing student and as a new nurse working in the med-surg unit, when I graduated nursing school back in 2010, I would always hear from seasoned nurses, make sure to check on your patient, go check on your patient, make sure that they're alive, go check to make sure that your patient is breathing. Now, that is something I've carried with me through my practice. However, I've taken it up a notch because once I started working in the ICU back in 2015, it was no longer check on your patient, make sure that they're alive. One of the things that ICU nurses are known to do or are trained to do is to not just check on your patient, but to establish a baseline with your patient. More importantly, a neurological baseline with your patient. And let me tell you how this practice, even though I am no longer in the critical care setting, I work med-surg, I pick up one shift a week when I'm not at my full-time job. Let me tell you how establishing a baseline saved my behind the other day at work. Approximately 2 weeks ago, I picked up a shift on the regular med-surg unit that I work on. It was a Saturday morning, night shift was getting off. So my night shift nurse who was leaving, she gave me a report, nice thorough report, gave me the Cardexes, handed me over her computer, and we got through report like pretty quickly. So it was about 7:32 when I signed onto the computer. Now my routine when working on med-surg is we do bedside report. So what we do is we stop at each room door and we kind of glance in the patient. We check on them to make sure that they're alive, the chest is moving, whether they're awake, whether they're asleep. We do that during the report exchange. Now, once the nurse leaves, I take the computer and I comb through the vitals. I like to see what the last set of vitals was because typically night shift will check vitals between 4 a.m. and 5 a.m. And once I come on shift, I want to make sure, just in case you don't get every single thing in report, I like to review my vital signs to make sure that they weren't anything abnormal, like an elevated temperature or an elevated blood pressure or even a low temperature or a low blood pressure, elevated heart rate. I just like to always check my vital signs. So that way when I go into each patient's room to update the whiteboard and check on them and establish my baseline, I know to bring a vital sign machine in with me if in fact the previous vital signs were abnormal. On this particular day, I am so happy that I decided to start super early. And I'm so happy that I started with the patient that I did. Now, I'm going to talk about this in another video because what I learned about in nursing school was something called nursing intuition. And I don't hear people talking a lot about it, but nursing intuition is such a real thing. It's a gut feeling. It's a guide. It's like inner voice that kind of tells you, do this first. So the patient I started with first was not the typical patient you would find on our unit. This patient was on the neuro services, so really he should have been on the neuro floor, but for whatever other medical reasons, he was on the floor on the med-surg unit that I was on. So I go in and I, for whatever reason, decided to do a thorough neuro assessment on the patient. Now, because this is med-surg, I am not required to do such an in-depth neuro assessment, but because of my training working in the ICU and caring for patients with neurological disorders, neurological diagnoses, whether it be like a hemorrhagic stroke or some kind of brain injury, for whatever reason, something said, just do your regular, thorough neuro assessment that you would have done if you were in critical care. And I proceeded to do that. Now, thankfully I did. I documented the neuro assessment because I had the computer with me. I documented the neuro assessment. I didn't document an entire shift assessment because I was still going about seeing my patients. I would get to that later. But the neurological portion, I made sure and I documented it. And the time that I documented it was 7:36 a.m. So that showed that I was in that patient's room as soon as I got out a shift report. Thank you, Jesus. Anyway, the morning goes along and this patient had a procedure pending in the next week. But to prepare for that procedure, they wanted to send the patient for a scan. So transport comes, they get the patient, take the patient down for a scan. Now, typically on med-surg, we don't travel with our patients to go to any of the scans. Within the ICU settings, the nurses travel with the patient because usually our patients are on some type of life support. So the airway, the ventilator, all of that, we have to go with the patient to be there. Also, depending on what drips and medications the patient's on, the RN has to be present for any kind of transport. Transport comes, they get my patient, take him for his test, and they bring him back. Now on med-surg, the mornings are super busy. When they brought the patient back, I was caught up in another patient's room doing something. So the transporter sticks his head in the room and he's like, oh, your patient is back. And I was like, okay, thanks. I'll check on him once I leave out of this room. Mind you now, I don't think we had no tech. And I think I was in the patient's room cleaning the patient up. So after that was done, I came out and I was like, let me go check on my patient who came back from the scan. And the reason why I had to go check on him was I had to connect back his tube feeding. I had to make sure that, you know, the IVs and all that stuff was put back in place as to how I wanted it to be. So upon entering the room, I realized, oh, there's someone in here. Now, I didn't know whether it was a physician's assistant, a nurse practitioner, or a resident. So it just so happens as I walked in, I asked them. I always ask when someone's in my patient's room, I always ask, I'm like, what service are you from, or what are you seeing the patient for? And he's like, oh, I'm the resident, you know, I'm the resident checking on the patient. Why is the patient obtunded? When I say obtunded, the patient is not arousable. The resident is like trying to arouse him and wake him up. He is out, not responding. So he's looking at me and he was like, how long has this patient been like this? I said, well, this morning when I came in, he wasn't like that. He was wide awake. He was not tracking me. He doesn't follow any commands for me, but he was awake. He was definitely not obtunded. And I'm like, CAT scan came, they brought him to CAT scan and he came back. I was in another room and now I'm here and you're here with the patient. So to be honest with you, between the time I saw him when he left for CAT scan, up until now, I don't know when he got like this. So he was like, yeah, this is definitely a change. He had to go call the attending physician. And let me tell you something. That attending physician, the neurosurgeon, don't play about his patients. I'm very familiar with him from working in the ICU. He do not play about his patients. So once he said, I gotta go call the attendant, I was like, oh boy, here we go. Here we go. But thankfully, I had established a baseline with the patient and I had documented the baseline, the assessment that I had done on the patient. So when the neurosurgeon came to do his own assessment, he's asking me a bunch of questions about, well, what happened here? Was he following commands? Did he wiggle his toes for you? How were his reflexes? So on and so forth. And I was just thanking God in my mind that I was able to answer all of his questions. And to be honest, and to be fair, those questions that he were asking me, he really shouldn't have been asking me that, because typically on med-surg, the med-surg nurses do not do such an in-depth assessment. If a doctor wants a neurological patient to have this in-depth assessment, the patient really should have been on a neuro unit where the nurses are in practice of doing such an in-depth assessment. On med-surg, we're like, the patient's stable. So typically the nurses will do just a basic neuro assessment, whether or not they'll check whether or not the patient's awake. If the patient verbalizes, they will check orientation, whether or not the patient's alert oriented to person, place, and time. Can the patient move their upper extremities? Is the patient following commands? A very basic assessment. They don't go into checking pupils. They don't check for corneal reflexes. They don't check for, what else? Even like whether or not the patient, they don't even really check for strength, whether or not the patient has an abnormal flexion, abnormal extension. They really don't check for that on a med-surg unit. But I was just thanking God that I established this baseline with the patient. This situation, I've been sitting on it for the past 2 weeks, and I'm like, I need to get behind the camera and share this story, because the main point I want to get across to new nurses, even nursing students, or those of you that are new to practice, specifically in like critical care, the most important thing you can do for yourself and for your patient is to establish a baseline. It is not good enough to check on your patient and check to see if they're breathing. That's what I learned in nursing school. That's what I learned earlier on in my career. But like I said, once I entered into the critical care space, they really stepped it up a notch to explain to me why is it important to establish a baseline, specifically a neurological baseline. So when you go into the patient's room, as you've assumed care of them, once you've gotten a report, you go into the patient's room, it's important to know if your patient is awake, If your patient's not awake and they're asleep, is your patient arousable? Meaning that if they're awake, can you go in there and wake them up? Do they wake up on command? Or is the patient difficult to arouse? If the patient is difficult to arouse, is this part of the patient's normal being? Is this just a patient that has a hard time waking up? These are things that needs to be established very early on in the shift. When you go into the patient's room, you need to determine, does the patient track? What I mean by that is when you walk in and when you enter into the patient's room, does the patient look at you? And can the patient follow you across the room if you walk across the room? Those are all important pieces of information that you need to establish very early on. Is the patient's speech clear? Can the patient move their left and right hand? Very early, do a quick neurological assessment so that way, if in fact a change were to occur later on in the shift, like what happened with me, if a change were to occur, you can say, well, no, after report I went in, the patient was awake, patient was alert, patient was tracking me, patient was able to squeeze my hands, patient was able to lift their hands. So that way, if anything happens and there's a deviation from what you established to be the baseline, at least you can say, no, when I came in, this is what it was. So very, very important to do. Long story short, the patient that I was taking care of, the neurosurgeon did discover some deficits. There was definitely a change in mental status. Long story short, he had to intervene and do what he had to do to ensure and to preserve the patient's neurological and whatever cognitive function the patient had. So that was that. I am just happy, thank you, Jesus, that I make it my duty to go into my patient's room early and establish a baseline, and I would advise you to do the same. So let me know in the comments if anything similar happened to you. Let me know if you have any questions, any thoughts. I do intend to come back with more videos like these, sharing my experiences so that way it can help a future nurse, a nursing student, someone new to critical care be better in their practice and just practice safely. Thank you all for watching.